Hello, I'm David R. Jones of the Community Service Society. On today's edition of the Urban Agenda, our topic is Medicaid. I will be joined by New York State Assemblyman Richard Gottfried of Manhattan and Christina Ho, a health care specialist on the staff of Senator Hillary Rodham Clinton. Before we begin our conversation, here are the comments of some New Yorkers we spoke with recently about health insurance.
I'm a widow, and after my husband died, and I went into the workforce, worked for about a year and had health coverage through the office. And when I left that job, because I'm actually a performer and a teacher, I found that I could not afford the health insurance to pay that monthly premium. I'm pretty healthy. I haven't had anything major happen in my life. So I chose to live without health insurance.
I don't have savings. I have very little, in the bank. I'm one of those average Joes who lives paycheck to paycheck. And I know I'm not alone. And 5 days in a medical center can cause me to have to declare bankruptcy.
I'm a tour guide, and after the disaster on 9/11, I found that my income was drastically reduced, and so I went down to the government agency down at Worth Street, and to my relief was issued a temporary Medicaid card.
It's just a matter of getting the information, and that's the key thing, to find out about it. And then once I found out about it, it wasn't very difficult to get. Basically, it feels good to have health coverage. It feels good to know that I can go to some help, health practitioners to get some things taken care of, and just to have it as a security, because you never know.
Disaster relief Medicaid has been just a lifesaver for me. A lot of people suffered from post-traumatic stress after the attacks, and so I had a great relationship with a counselor, and had I not had this, I could not continue with my work. It's just been a gift from the heavens.
I was amazed to receive a piece of paper that was actually allowing me to receive Medicaid immediately from that day forward. And there was really basically no paperwork to be done other than I had my regular information, but that was it.
I think it's very important for this country to have health coverage on a national level. That's something that's missing from one of the wealthiest countries in the world. I mean, countries in Europe, such as Sweden and other countries in Europe, have health coverage for their citizens, and that makes it's total ludicrousness. And here's Bush asking for $45 billion for the military. It's ridiculous.
Joining me now is Richard Gottfried, chair of the New York State Assembly's Committee on Health, an advocate for the Disaster Relief Medicaid program. Dick, welcome to the Urban Agenda.
Thank you. Glad to be here.
Let's describe to people what is Medicaid first. I think sometimes we assume everyone understands what it's about.
Well, Medicaid is in a way two programs. It provides long-term care coverage to a lot of elderly and disabled folks, but most of the people on Medicaid are poor people, and it's a program of federally and state and local funded health coverage basically for low-income individuals and low-income families with kids.
And we're talking very low income. I think the cutoffs we've heard, $13,000 for a family of four.
Well, for traditional basic Medicaid, it's the cutoff is well below the poverty level.
Right.
The Family Health Plus program, which was created by the legislature 2 years ago and is only just now being rolled out by the state here in New York City, will raise the eligibility level for Family Health Plus, which is sort of a variety of Medicaid, up to 100% of poverty for individuals who don't have dependent children, and 150% of poverty for individuals who do have dependent children.
So that'll add more people. But really, what we're here to talk about today actually is something called disaster Medicaid in the wake of the World Trade Center attack.
Right. When the World Trade Center collapsed on September 11th, one of the pieces of damage was the computer lines between New York City and the welfare bureaucracy in Albany were destroyed at 7 World Trade Center. So all of a sudden, the city found that it wasn't going to be able to enroll anybody in Medicaid for a long time to come. And to some extent, the concern was that there were a lot of people who had lost their jobs. There would be a lot of new, poor, uninsured people, and how are we going to deal with that? But I think, at least on the part of the governor, the main concern was that the computer lines had been destroyed, and so they were desperate to find a system that didn't need a lot of data filled in. And the solution was something called Disaster Relief Medicaid, under which anyone in the 5 boroughs could apply for 4 months of Medicaid coverage simply by filling out about a half-a-page form that gave your name, your Social Security number. You just put down what you said your income was, and by the end of the afternoon or the next morning, you had a Medicaid card, which is a speed and a simplicity utterly unheard of in the Medicaid program.
Now, how well has it worked? Has it brought a lot of people out?
Well, it has been just stunning. In the 4 months that the enrollment window was open, 380,000 people enrolled. Now, to give people a sense of that, in the whole life of the Child Health Plus program, which is publicly funded health coverage for moderate income children, there's about 500,000 kids enrolled. We got 380,000 people enrolled in this program, even though the government did about 0 to let anybody know that it existed. There were no full-page ads in the paper like there were for the help for small businesses. It was almost entirely word of mouth, plus an effort by a lot of the community-based organizations to get the word out. People were literally lined up around the block at application sites to sign up for the program. It was just stunning, and I think it has demonstrated, as if it needed demonstrating, that there are, I mean, I think we've all known, many of us have known for a long time, there's well over 1 million people in this state who are uninsured but who are legally eligible for Medicaid or Family Health Plus or Child Health Plus, but have been kept away from it by the incredible array of bureaucratic obstacles that we have. And what Disaster Relief Medicaid showed is that if you tear all that down, they will come.
Well, I think you've talked to a major point, which is the fact that the traditional Medicaid program, the application, I took a look at it very recently, would basically, I think, if our viewers ever got to see it, and its sum, is in some cases an insurmountable barrier for people to getting this application done.
It does amaze me that anybody gets through that maze and gets Medicaid coverage, let alone people who are poor, whose lives are somewhat disheveled to begin with. I mean, if I had to personally come up with the documentation evidence that they asked for on Medicaid, it would take me and my wife an awful lot of effort.
Well, essentially, people have to come in and are told they don't have enough documentation, sent home again, and often have to come back and forth repeatedly before they're made eligible.
And if they're working at low-income jobs, they may lose their job by having to come back again and again, by taking time off work. It's a horrendous system.
Well, after this 4-month period is over, what happens to the 380,000 people?
Well, our concern was that when the first group of people started to run out their 4 months at the beginning of February, they were just going to fall off the program and go back to being uninsured. Thanks to hearings that my health committee held and the people like Community Service Society that testified and a lot of advocates who got involved, the State Health Department finally came up with a transition program. People on disaster relief will be given an opportunity now to come in to fill out an application form, and they will get to keep their Medicaid coverage until that application form is either approved or rejected.
And this bill has now gone through, has been...
Well, the sort of transition on disaster relief Medicaid is now in place. A couple of weeks ago, the legislature passed the health care package that many people heard about. Part of that package that we were able to get put into that package, we being the Assembly, was about half of the agenda that we've been pushing to simplify enrollment and recertifying in Medicaid and Family Health Plus and Child Health Plus. So a lot of that simplification will now be the law of the state.
So that will apply, obviously, people who run the 4 months out under the disaster Medicaid, as they reapply, will now be confronting
Well, the new legislation won't kick in until sometime next year.
Right.
But the state and the city have said that they want to have as simple a process for the disaster relief people as possible. And since they will all be applying here in New York City, I'm pretty confident that the city administration will be doing a lot more than might be done in some other parts of the state to try to help this run smoothly.
Well, let's talk about beyond just the lives that are made better if people can get access to health care and health insurance.
Right.
Does this have another implication? If we can start to enroll beyond the 380,000 and actually start to dig into the number of uninsured, does this have any other impacts on health care in the city and state?
Well, it certainly does, because the 3 million uninsured here in New York State do show up at our hospitals and clinics for health care, and they do eventually get care. Usually it's when their condition has gotten worse and it's more expensive.
Sure.
But when they don't have health coverage when they walk in the door, that means that the hospital that you and I would go to has less money, less resources to have nurses and doctors on hand when we arrive with whatever we might arrive with. And so the wealthiest of New Yorkers arriving at a hospital is going to get less quality care, more stretched out care, because of the number of the patients at that hospital who don't have health coverage.
And again, what about the notion of do these individuals actually need advocates as they come in? And one of the issues is if I'm somebody with limited English proficiency, for instance, or I'm in Spanish or in Chinese or in Creole,
Right.
How do I access Medicaid, both in the disaster system and the ordinary Medicaid system?
It can be very difficult because if you go down to the welfare office, you're not going to find people who speak the 150 languages in New York.
Right.
One of the programs that we've been developing in New York in the last couple of years and is expanded in the health package that we passed in January is something called facilitated enrollment, which is a system in which the state gets into a contract with community-based organizations, healthcare providers, and the like, to basically do the enrollment work for people who walk in their door looking for Medicaid coverage. So you will now have more organizations rooted in the community able to essentially do and help people do the paperwork to get the health coverage they're entitled to.
On a smaller scale in the city of New York, obviously the city's ombuds program that the Community Service Society coordinates is trying to do the same thing, and that clearly is an engagement we need to pursue, not only for the city of New York, but statewide.
Yeah.
Thank you, Assemblyman Gottfried, for joining us. We'll be back to continue the urban agenda.
It doesn't matter who you are, or what you drive, or where you live. You have the power to give someone the greatest gift in the world, life. Talk to your family about organ donation. Talk to your family about donating life.
Welcome back to the Urban Agenda. We're talking about Medicaid, and joining me now is Christina Ho, who is on the staff of Senator Hillary Rodham Clinton, specializing in health care. My thanks for joining us.
Oh, thank you for having me.
Well, give us some impression of where the Senator's agenda is on health care, particularly health care for the poor at this point.
Well, it's very much influenced by, what the climate is now politically. I think, she has stated very clearly that she wants to continue to pursue a lot of the objectives, but, in a step-by-step way. Let's, do what we can in an incremental fashion. And, some of that is building on the successes of the CHIP program, which was enacted in 1997. And, one of the things that she's talked about a lot is something that New York has taken the lead on, which is making parents of eligible children eligible for CHIP and Medicaid as well. And this is something that she's been pushing in the Senate. It helps children because children enroll when their parents enroll. So it's really something that's both for the family as well as for the kids. And expanding CHIP to more kids is another piece that, may not sound brash or sexy,
Right.
but it actually makes a big difference. I think I've heard that, across America, maybe 3 million uninsured kids are above 200% of the federal poverty level, which is the cap on
Right.
income eligibility for the CHIP program. You could cut that number in half just by extending CHIP up to 300% of the federal poverty level.
And this is really very cost effective. The cost actually of providing health care for kids is not astronomical. It's when you
That's
get
right.
middle-aged like me that starts to really go through the roof. But clearly, is there sort of bipartisan support for this kind of activity, or is there a lot of resistance to the notion of expanding coverage for children?
I think there are philosophical differences, and there, frankly, is just a shortage of funding that people, are sort of fighting over how to spend on the different priorities. I think we've heard a lot about, the budget deficits that are coming down the road. So, I think there's support for providing coverage for children, but I think some people, aren't sure whether it should be done through public programs or, while we feel that that is a very cost-efficient way to do it.
And before I go too much further, I should explain to people what CHIP is. What does it stand for, and how does it actually work?
Well, CHIP, which is actually SCHIP, stands for the State Children's Health Insurance Program.
Right.
And it is a joint federal-state funded program to provide health insurance for children who may, be in families with incomes that don't qualify for Medicaid. And that goes all the way up to 200% of poverty. And it's been incredibly successful. States can set up programs of their own. States can expand their Medicaid programs in order to cover these new populations of children. And, this is something that we would like to see, continue, get more kids enrolled, and sort of really build off those successes.
Well, let's talk about the expansion to parents. Obviously, this starts to get a little more costly. Are there sort of cost estimates of how much this would cost and how we'd pay for it?
Well,
since we have to be all very sensitive to the
Right.
revenue side now.
That's right. Well, the proposal that
Right.
that Senator Clinton supports is estimated to cost, I think, in the neighborhood of $80 billion over 10. Now, that is a significant investment. In the president's budget, there's about 80 or 90 billion for individual health tax credits. And, again, I think it boils down to, where do we best spend this money? It's been shown that you can cover almost twice as many people if you spend the same amount of money in expanding CHIP than in healthcare tax credits, for example.
I guess it's particularly serious for a city like New York. I think people often see this as just the sort of driver's side, people trying to get health care. But in New York, it's also one of the largest, industries. I mean, 21% of the workforce is in health and health-related fields. And clearly, if the revenue dries up from all these people, it's going to be very difficult to sustain a whole sector in the New York City and state economy.
Oh, that's exactly right. And, the hospitals are often the largest employers in any particular municipality.
Right. Well, in my own neighborhood, in and around Bedford-Stuyvesant in central Brooklyn, Kings County Hospital, which is a municipal hospital, is the major employer, bar none. I mean, by a factor of 5 or 6. If Kings County, which is a huge municipal hospital, were to falter or have to contract dramatically, the entire economy would implode in that neighborhood.
And this is such an important point, particularly because of the recessionary economy. I think Senator Clinton has been very vocal about saying that healthcare is an important part of, economic recovery, because these are jobs, and these are dollars that are being spent in the economy that will stimulate growth. So I completely agree.
We've talked earlier about the whole issue of how difficult it is for people to enroll in Medicaid, and obviously the disaster Medicaid. Does the senator have any views in terms of what should be done to make it a little more seamless for people who are actually eligible to get into the Medicaid program?
Well, I think the simplifications, sort of bringing the application down, eliminating barriers that don't always make sense. Take, for instance, the assets test.
Right.
You want people to be able to own a car to get to a job. You want people to be able to save up money and, get out of poverty and do the things that they need to do in order to, get ahead. And, there are pieces like that that really need to be addressed, the face-to-face interview. But one thing that I think the senator has talked about, and really maybe one of the more creative things that we could try to push this year, is having a high performance bonus for states that do well in Medicaid enrollment and retention. I mean, this is something that was a concept, obviously, in the TANF context, but if you sort of borrow that idea and really bring some accountability and recognition to states that do well, I think that could really, benefit the situation. And certainly we've seen with disaster relief Medicaid,
Right.
when a state wants to do a good job, it really can.
Well, as a matter of fact, the standards states use for Medicaid are essentially the state-driven decision. So in other words, in this state could set a series of standards that have nothing to do with the state next door. Is that how it works at this point?
Medicaid is, the eligibility is determined state by state. There are certain eligibility categories that the federal law sets. But, certainly it's a state-run program, state-administered program, and so these are things that states have control over. And I think the role for the federal government is to support states that are doing well, encourage states that are doing well, and set some basic standards to make sure the program works.
We've certainly seen, as we start to look at the Medicaid enrollment forms for New York against other states that are somewhat more progressive or not progressive or more interested in enrollment, that the difference is just profound. What can take less than 10 minutes in one state is likely to take, on average, days if everything works out right and you happen to have records that I, for one, as my wife always tells me, do not keep appropriately. It can be impossible. You can never get it, and we've seen that. Let's talk a little bit about the issue. New York State is going to go to full requirement for Medicaid to be in HMOs. Anyone who's had an HMO experience, I mean, it's not the kind of thing in cocktail discussion if you talked about what your HMO did to you lately. How is it going to be that particularly poor people, some of them with language problems, are going to be able to navigate an HMO environment that middle and upper class people dread themselves?
I mean, the red tape that's involved in our current healthcare system can be so daunting, not just for people who are on publicly subsidized insurance, but also people who are on employer subsidized coverage.
Right.
And so programs like, ombuds programs, the Managed Care Consumer Assistance Program, for instance, are such an important service just to give people a place to go in order to make sense of their rights and responsibilities. The senator, along with Senator Reed of Rhode Island, Senator Jeffords, and a few other colleagues introduced a bill last spring which would provide federal funding to states to help support and create these kinds of ombuds programs and expand that service.
And is there anything, is there a federal sense? It was interesting as we've toured around the state to try to get support for the ombuds program that the Community Service Society helps coordinate. It's clear that in every state, and it was interesting, this seems to be the most bipartisan issue I've ever run into. When I come into some of the upstate tier Republican senators' offices, they won't talk to me about welfare and TANF. As soon as I start to talk about HMO difficulties of their constituents, apparently in constituent office after constituent office, people are coming in. I came in. I had this simple procedure that I wanted to be done by a doctor. They said I had to do it with a plan doctor, but the plan doctor is no longer working on this kind of procedure. The kind of Mickey Mouse runaround and the feeling of total impotence here is profound. I don't know if that's coming to as you read the mail coming into the senator, but...
Oh, certainly. I mean, managed care problems really predominate in terms of complaints that people have about aspects of their lives that are very important to them, obviously, and health is one of those. And you'd think that this would be such a bipartisan issue that you could get something accomplished. This ombuds program was successfully inserted into the Senate-passed version of the Patient's Bill of Rights, and that, unfortunately, is caught up in some differences with the House and the Senate-passed version. But we really continue to hope that that can get worked out so that we can move forward.
Well, if we can figure out any way to give it a boost, not being partisan, but clearly this seems to be something that seems to transcend all economic levels in the society. And even it's interesting as you talk to the managed care companies themselves, they recognize it, that there has to be something to make this system a little more efficient, to sort of bring the benefits that everyone had hoped out of managed care, cost savings and improved quality.
Right.
My thanks to Christina Ho and Richard Gottfried for joining us today. Many New Yorkers were impacted by the events of September 11th. For thousands of families, the potential loss of health coverage remains a crisis. Healthcare is one of the most pressing problems for very poor and working poor people in New York City, and continues to be a major issue that must be addressed on the city, state, and federal level. I'm David R. Jones of the Community Service Society. Thank you for watching The Urban Agenda.
To comment on the Urban Agenda or for more information on CSS, contact Community Service Society of New York, 105 East 22nd Street, New York, New York 10010. Area code 212-254-8900.